Can food be considered medicine? What is lifestyle medicine? Find out this and more on this episode of Housecall. Hello and welcome to Housecall. I'm Dr. Steve Kariya. Tonight, my special guest is Dr. Aruna Nathan, an internist here in Montgomery County, who is an expert in lifestyle medicine and will be talking to us about food as medicine. Aruna, please tell me about your training, your practice, your positions with the Montgomery County Society.
Thank you for having me. I'm originally from India, Mumbai, Bombay when I left it, and I finished medical school there. I did my training here in my residency internal medicine at Union Memorial MedStar in Baltimore. And since 1998, I have resided and worked in Montgomery County, and you know, as an internal medicine physician. Currently, I work in Absolute Care, which is a value-based care organization, and we are our members or our patients are patients with Medicaid, and I work as their forget my role.
Physician.
A physician. So I'm the lead
team
physician,
leader,
or I'm the lead physician for lifestyle medicine and whole person health.
What does food as medicine mean, and how does that fit into lifestyle medicine?
So for me, when I think of food as medicine, I think of how am I going to use that or use that knowledge for my patients as an internal medicine physician. And when I put it in the lifestyle medicine frame, it's about building healthy eating habits over a period of time. So it's more of eating patterns, which are small changes over time, which are sustainable, and they give good results in terms of better blood pressure, better body weight, better mood, better sleep. And
how big is the current problem, like chronic diseases like diabetes, heart disease, high blood pressure in the U.S.?
Very big issue, right? We all know it. We see it every day as physicians. If we think of high blood pressure, 50% of the adults or more have high blood pressure, and diabetes is also millions of people have diabetes, pre-diabetes, and many don't even know about it. Obesity, every time I have to double check the number because it's 40%. So it's such a major issue when we think of chronic conditions. These are conditions that we need to have ongoing patient contacts or long-term care, and they have major implications on our lives in terms of our quality of lives, in terms of what we can do, disability, and also death, you know.
How does what we eat influence these chronic conditions? For example, blood pressure, blood sugars, cholesterol?
It has a direct correlation, because if we just were to look at high blood pressure and sodium content and look at American Heart Association guidelines for sodium content or milligrams of sodium that one should consume in a day or can consume in a day, it's 1400 to 1500 milligrams. And if we were to look at what an average American or one of us were to consume without having that knowledge, it's close to 3,400 milligrams. And when I talk about American Heart Association guidelines, it's for patients with high blood pressure or diabetes or other cardiac risk factors. So these are things that are just from milligrams of an element point of view. Similarly, sugar, you know, it's in so much of our ultra-processed foods, and they do contribute to obesity and fatty liver disease. So these are just from elements, you know, sugar and salt. But if we look even further into oxidative stress and inflammation, the foods we eat helps us build healthy cells, or it may work against us. So food can help us live healthier lives, but it can also work against us.
So, Aruna, in what ways do environmental and lifestyle changes, especially diet, affect our cellular health, our aging, and how diseases progress over time?
That's an excellent question, because when we think of chronic medical conditions like high blood pressure or diabetes or heart disease or kidney disease, we have always associated that with aging, because as you get older, you get diagnosed with these conditions and then you start taking 1, 2, 3, and 4 medications, right? But if you were to think of what is actually happening in the body at the cellular level, there is cellular damage to the DNA over time, over the years, because of stimuli which are noxious either externally or internally. So the external ones could be considered food, because we are eating food. It could be temperature, radiation. Internally, it could be things like your sugar levels, your blood pressure. Also, stress plays a major role, and this is responsible for cellular changes and degeneration over time. And so environmental factors, where we live, what we eat especially, play a huge role. But it doesn't have to be that way. We see so many people amongst us, and especially in certain parts of the world, where they don't get diagnosed with these conditions, or they're not on so many pills. So it doesn't have to be an inevitable part of aging. So we have to figure out what is different in certain populations or in some people. And they've studied this, more specifically, and they have shown that ultimately aging or age-related diseases are related to cellular changes over time. And
so how do these social and economic factors, where people live, work, and shop, how do they shape their food choices and diseases?
It's a very, very important question, because it cannot just, when we think about lifestyle and we talk about choices, we have to keep in mind that it's not the same for everyone, right? Because where you live, where you work, determines so much of this. Where there are some parts in Montgomery County where we may not have access to healthy food. People may not have the money to buy that healthy food because it is more expensive, right? It's easier to find chips in a corner store. It's difficult to find an apple sometimes, right? And so, or fresh leafy veggies. And so access is a major issue. In addition, it is the same population that's also affected more with chronic conditions like diabetes and high blood pressure. And so they already have intrinsic factors which are affecting their health. And in addition to this, the extrinsic factors of not having access to good food or places where they can go for walks also play, because all of this plays a big role in your health.
How do everyday habits such as food choices, exercise or movement, sleep, stress, how do they support the body's ability to repair cells and tissue?
So the human body is pretty magnificent in a way, right? The cell is has its own, or every, like when we talk about the cell, each of the organ systems is ultimately, you can look at it at a cellular level. And each of these cells has an intrinsic or homeostatic mechanism of balancing or repairing damage over time. Over a lifetime of a cell, there are thousands of times when there are damages occurring to the DNA, but there are inbuilt repair mechanisms. And when we get enough rest and get enough sleep, we eat the right foods, we know how to de-stress. I wouldn't say we'll all have stress, but how do you know how to mitigate stress? When we do these things, we are helping or supporting the at a cellular level to make these cells healthier.
So how does eating healthy, what does that really look like in day-to-day life for our patients and ourselves?
Sure, because we have to think about ourselves as well. I often think about my residency days when you come home post-call and you don't have time.
You would eat whatever was in the vending machine.
Yes. So it's, and you don't know until you really know, right? And when I think of eating healthy, I think more of not something is good or something is bad. I try to avoid that. I think of eating more of the healthier things on a more consistent basis. And that's what I would also, when I work with my patients, that's what I would like to emphasize on. It's not about not eating something. It's about eating things that are good for you and eating more of it over a time, because it's the eating patterns that actually play a big role. But there's so much out there that sneaks into your foods, like sugar and salt and saturated fats, to be aware of what they are. And if we actually were to look through about a week's worth of what we are eating, we'll identify those very easily, because we tend to go back to the same things again and again, most people. So if we were to just do a scan for about a week and know what we are eating, and then look at the nutrition labels, look at the salt content and the sugar content, we'll have an idea, and then we can make some smart switches.
So what do the major medical societies recommend as first-line therapy for chronic illnesses, and where does nutrition fit into these recommendations?
So in fact, all of the major medical societies, American Heart Association, American Diabetes Association, for example, all of them recommend lifestyle first. So when there's diagnosis of high blood pressure or of diabetes, lifestyle is the first recommendation. We've always been taught that in medical school. But what we've not been taught is how to go about that. How do we meaningfully convey this lifestyle? What is that to our patients? Because I'm sure you've never had a patient, I don't know, but I don't know if you've ever had a patient tell you, I didn't know smoking is bad for me, right? They know that. So, but the thing is, so it's not about just knowing, but how do you actually make this practical for the patient?
Yes.
And a habit that they enjoy and they want to do more of. And so all the major medical societies recommend lifestyle, but I think the American College of Lifestyle Medicine has worked on making this very approachable in an evidence-based manner.
Because I think all of the recommendations for high blood pressure start with appropriate diet and reconsideration of how much salt that we all take in. And just for an example, and of course for diabetes, it's calorie counting and making smart choices from the major food groups.
Exactly. And but if we were to have a patient, definitely we want the patient to work with a nutritionist if they have access to a nutritionist, but to give them practical solutions based on these guidelines, and also to kind of make it very individualized for them. That's how I would like to see food as medicine being used.
What is gut health? What are vitamins? What's the role of vitamins and probiotics?
So gut health is gaining more and more traction because we are learning more now about the millions of microorganisms that live in our gut, on our body, on our skin. We have more cells which are not human and more DNA which is not human in us and on us compared to our own cells. And so it's really important to learn more about it, because there are byproducts from these organisms that can help our health, but they can also may be harmful. So we don't know, they're still working to figure out which ones they exactly are. Maybe there's a time we know exactly which probiotic capsule to prescribe for what condition. At this point, we may not have all those answers as of yet, but we do know that prebiotics or what these probiotics or these organisms live off of are the fibers in our food. So foods that are naturally rich in fiber are really good for the good microbiome or the good gut microbiome. And plus we're learning more about the gut-brain connection as well, and how food can affect our mood and our mental health.
So I have to apologize. We've got to take a quick break. We'll be right back. Welcome back to House Call. Joining me today is Dr. Aruna Nathan, and we are discussing food as medicine. Aruna, what challenges do people with lower incomes or less resources face when they're trying to eat healthier?
It's access issues, number one, because there is lack of access to healthy foods in some of the neighborhoods. And the second thing is they may already be burdened with chronic medical conditions and also mental health issues. And so there is definitely higher incidence of these conditions in certain areas and certain pockets, and they overlap with the places where there is food insecurity as well. And so all of these play a major role in having good food, because good food is essential for healthy living.
And it sometimes is more expensive. I would imagine
yes.
Finances are a big
yes, for sure. For sure, yeah. Food insecurity is a big thing, and it plays out in different ways because it's the whole family unit that is affected when one of the members is sick, and also there's healthcare dollars and money spent on medications that is being taken away from what could be for the family. And when you have less resources, you also don't want to experiment with foods that may be healthy, but you don't know if your child is going to eat it, and so there's less chance to take those risks.
How hard is it, or why is it hard for busy clinicians like yourself or myself to take a good food history and give specific nutrition advice during a typical office visit?
So it has to do mainly with how we, the system of practicing medicine, in terms of the amount of time you get to spend with the patient is very limited. If we were to follow the guidelines that the major medical societies have for talking about prevention in terms of food history or physical activity, it would take hours. It would take more than the number of hours we have in a day to see 15 or 20 patients a day. So it is really, really difficult for most clinicians to actually follow the guidelines because there is just lack of time that is built into the schedule. The other part of it is also some amount of lack of education in medical schools on nutrition, and hopefully it's going to get better now. So those are the two big reasons. But time, I would put that on top of everything.
What core nutrition topics do you prioritize in your visits, such as reading labels and meal planning? It depends on the patient. So it depends on what the patient is coming in for. But in general, I'd like to try and make it as practical as possible. So nutrition label reading is big because knowing how many servings are there in a container is the first place to start. Because if you are having something, looking at the nutritional information, and you're having 2 or 3 servings instead of 1, the math will be all wrong. Yes.
So, serving size, what's the sodium content, what is the sugar content, how much of that is added sugar, where do you look for added sugar, what are some of the tricks that you can use for sodium content. So, for example, if there's a calorie to sodium ratio, we want it to be close to 1:1. So there are some simple tricks that we can learn with just the nutrition label reading. But in addition to that, what are the foods that are actually nutritious and they are high in nutrition but lower in calories? So things like foods high in fiber and water, so beans and lentils and vegetables and fruits, these are things you want to get much more of in your diet.
Behavior is so critical to improve nutrition and food choices. What are the barriers for patients and ourselves in terms of improving our habits?
So habit is the key. So we may know so many things, but we may not do it because it's just not our habit, right? And so having to look at this from not just the person in front of you, but where they come from, where they live, who do they live with, and looking at it more holistically. And I really for this part, I rely so much on our behavioral health consultant where I work, because I get to know so much more about the patient because we work together, and then we also see patients one-on-one and talk about it. And then we try to make that change to be more fun. So making a behavior that sticks is something that they enjoy. So try to see what they like to do. So sometimes they may not want to start with making changes in food. We may start with physical activity like exercise and then introduce food. So once you have one major behavior change, they can easily get the second or third one.
How do you tailor food-specific advice, or how do you tailor food advice for patients who have specific health conditions like high blood pressure or diabetes or kidney disease?
It's very important. We definitely want to tailor it to the patient. For example, for diabetes, many a times we would talk about increasing complex carbohydrates in patients with high blood pressure. Even with diabetes, that is a good thing to do. Even fruits is good for patients with diabetes, but how much of it per meal is really important. And we are learning more and more of this because people are wearing continuous glucose monitors, and we get to understand these sugar patterns even better. So for a patient with diabetes, the meal plan would be different than for someone with high blood pressure. And then if someone has heart failure, it would be different. Definitely, I'm not an expert on that. I would love to work with a nutritionist to do this kind of work with them. But in general, you hear so much now online. So patients come to you with so much information, and so much of our job is just, demystifying or busting those myths about nutrition.
Aruna, can you tell me what your office visits are like and what your practice is like?
So where I practice now is in Prince George's County, and we have a very team-based approach. So it's me, a behavioral health therapist, a nurse who's assigned to a specific panel, and so it's a very holistic or a whole person approach when we take care of these patients.
And how do you do these shared medical appointments?
Definitely. So we do shared medical appointments mainly to address these issues of not having time when we are seeing patients one-on-one, to address some of these key lifestyle and diet and food related questions and issues. And when we conduct these lifestyle medicine or shared medical appointments, we have myself, a behavioral health consultant, and a team nurse or a care plan manager who is an RN present at the same time. And sometimes even our medical assistant, because she does meal prep and she is able to talk about what she does, and the patients are able to relate to that. So we each play different roles. I talk.
And this is for how many? It's not just one patient.
No. So when we do shared medical appointments, we have anywhere from 8 to 12 patients. On an average, we have 8 patients, and this is done for about 1.5 hours. And
wow.
Yeah, and so it's a planned. We run it in a planned manner. So we start off with something like a mindfulness session for about 5 to 10 minutes, and we end it with a chair Zumba, because our nurse is also a Zumba instructor. And in between, we have, we talk about different topics. And initially, we would have topics that we have outlined. So say sodium content or sugar or ultra processed. What is ultra processed foods? What is, but ultimately now the patients drive the conversation. So they start from learning from each other, but then they ask questions.
And are they organized by certain disease conditions, or how are they organized?
Yes, so we do have it organized by disease condition. We have one, we call it the 2 evil twins, basically salt and sugar. So we have the high blood pressure group, and the high blood pressure group is mainly patients with high blood pressure and kidney disease, stroke, and heart disease. And we have the diabetes group, which is patients with diabetes which are with very high numbers, so hemoglobin A1C greater than 10. So we still have patients with diabetes in the high blood pressure group, but the diabetes is mainly more of people living with very high sugar numbers. And those are our two groups.
And so you tailor each specific set of instructions and coaching,
yes,
almost coaching,
yes,
for food choices and food management and preparation,
yes,
as well as exercise to these different choices.
Yes, yes, we do have chefs who come in as well, and they actually go over the food preps, and we just give them like 5 or 6 ingredients and have them show us different ways to use those 5 or 6 ingredients so you can make up to 5 meals.
And you're able to make this work economically?
So right now where I work, it's a value-based care organization, so they are able to do it. But before, when I was in private practice, I could do this myself because you can actually bill for these visits. So you're billing like you would bill for seeing a patient in the office, and you can bill for these patients simultaneously, and yes, you can do it.
So spending an hour with a total of 4 patients at 15 minutes apiece, whereas you're really meeting with a dozen patients for an hour.
You're meeting with a dozen patients for an hour or an hour and a half, but you're also giving them, you're able to do so much more with it, because
yes,
you're able to, when I was in private practice, I had contracted with a part-time dietitian and a part-time lifestyle coach. And so they were also a big part of this practice. So you're able to, do more than what you would do traditionally in a practice.
Are these sessions fun?
They are absolutely the most fun. I have invited you, and that invitation is open, and it really is the highlight of the day, and I'm just coming from one.
And so you had a dozen patients or so, and you were talking about what?
So today we had 9 patients, and today, today we talked initially about we had like these games with them now. So we had like grounding technique, and what is considered grounding technique, what is considered mindfulness, what is, so we had like these different, they had to match it. And then we talked about it. Then we went on to 2 or 3 different exercises of label reading, and they had to figure out which one belongs to which one. So there were 2 chips. One is the Kettle brand chips, Kettle oil cooked, and the other one was the more common chips, and then they had to identify if one is healthier than the other, or it's just front of the package labeling, so they're equally bad or good. and then we went on to differentiating between Bush's beans and Amy's beans. So one is vegetarian and healthy, or is it really healthy? Because it says it's vegetarian and organic, but then when you look at what's inside, it's almost similar, or is there a slightly different sodium content? So this was an actual exercise that we did with them. So they when they go to the grocery store, it's not like they're trying to solve a complex problem. It just comes much easier to them.
Your face lights up when you talk about this. You enjoy it.
Yes, I love what I do, yeah. This is definitely something that I enjoy, and I want to see a lot more people doing this, because it brings a joy back into medicine, especially today when there's so much burnout. This would be an antidote for that.
Well, look, this has been a wonderful time spent with you. I'm so grateful for the knowledge and the enthusiasm that you bring to a very complicated topic and a very different way of practicing medicine. So, Aruna Nathan, thank you so much for joining us. Thank you to our visitors and viewers. I'm Dr. Stephen Kariya. You've been watching Housecall. See you next time.